Mr. DC has granted permission to be recorded on this assessment. Hi, my name is Kendall. I'll be your nurse today. Before we get started, can I have you tell me your name and your date of birth?
DC 4992.
Perfect. What brought you in today?
A checkup.
Okay, can you tell me today's month and year?
July 2022.
Okay. Before you came into the room, vitals were taken. Your blood pressure, heart rate, oxygen saturation, respiratory rate, and temperature were all within normal limits. Are you experiencing any pain?
No.
Okay. So today we are going to do a general head to toe assessment. I'm going to wash my hands, provide privacy. And to start off by assessing your head and face. Your head is normocephalic and midline. And your skin is pink, normal for ethnicity. It is warm, dry, smooth without any lesions, bumps, blemishes, scars, bruising in the V, and your skin trigger was less than 3 seconds. And now I'm going to palpate your head. Any tenderness there?
No.
Okay. Hair distribution is even throughout. You have brown, normal texture hair throughout your head, and that is free from lesions, masses, tenderness, depressions, and infestations. Did you have any pain whenever I palpated your head?
No.
Okay. Palpate your temporal arteries. Any pain there?
No.
Okay. Next is the lymph nodes. I'm going to start out by doing your pre-auricular, post-auricular, occipital, tonsillar, submandibular, submental, anterior cervical, posterior cervical, and your supraclavicular. Next, I'm going to do your cranial nerve number 5, starting out with the motor. Can I have you clench your jaw? Any pain there?
No.
Okay. And you can unclench your jaw. Next is sensory. I'm going to have you close your eyes and let me know when you can feel this.
No. No. No.
This will be cranial nerve number 7. Can I have you smile, frown, puff your cheeks, raise your eyebrows? Perfect. And your face. Next, I'll be assessing your ears. I'm going to take a look at them. No drainage present. No drainage present there. And your ears are symmetrical and equal in size. I don't have an otoscope, but if I did, I would pull the pinna up and back. And I'm going to palpate your tragus and your pinna. Any pain there?
No.
Okay. And no masses noted there. Next, I'll be assessing the cranial nerve number 8. I'm going to say 3 words, and I need you to repeat them after me. Will you close your left ear? Okay.
Dog sit leg.
Okay. And do the same for your right ear.
Dog run stay.
Yes. I don't have a tuning fork to assess for hearing loss. So we'll be moving on to the eyes. I'm going to take a look at them, and look at your lashes and your eyebrows and palpebral fissures. Lashes are black in color, evenly distributed and turned outward. Your your brows were brown in color, symmetrical and evenly distributed on both sides. And your palpebral fissures are equal and evenly placed in line with each other. Next, let me take a look at your sclera and your conjunctiva. Okay, sclera is white, conjunctiva is pink, and free from discharge and lesions. Next, I will be assessing your gross visual acuity and peripheral central vision. Cranial number 2. Can you read this letter for me?
R.
Okay. Next, I'm going to have you close your right eye and tell me what number I'm holding on.
4.
Okay.
2.
Okay, now do it for the other side.
4. 2.
Okay. And the next, I will assess your cranial nerve number 3 for your pupil response to light. And that is brisk. Next, I am going to attest for accommodation and convergence, which is cranial nerve number 3. I'm going to have you look at my pen, and I'm going to move it closer to your nose and just follow it. Perfect. And your pupils constricted as I move forward, so that's normal. Next, I'm going to test your cranial nerve number 3, 4, and 6, and I want you to follow this pin. Great. And now I do not have a ophthalmoscope available, so I will not be performing. Next, we'll continue on to the nose. I'm going to shine a light up there to take a look. Okay, septum is midline and straight. Next, can you plug one side of your nose for me, please? And breathe in and out. And do it for the other side. Any trouble there?
No.
Okay. And now I'm going to palpate your frontal sinus. Any pain?
No.
And your maxillary. Tenderness or pain there?
No.
Moving on to the throat and mouth. Your lips are pink without cracks and lesions. Can you open your mouth and say ah? Okay. Your teeth are and gums, palate, and tongue are in good condition. Can you raise your tongue for me? And your floor of your mouth is also in good condition. And your tonsils are visible, and they're a grade 1 with no pharyngeal exudates. I'm going to palpate for your TMJ. Can you open and close your mouth a couple times for me? Okay. Did that hurt?
No.
Okay. No subluxation or crepitus noted. And now I'm going to have you Open your mouth and say ah again. I'll be assessing your cranial nerve number 9 and 10. Say ah. Okay. Your soft palate and your uvula were midline and they rise symmetrically together. And now I'm going to say ah, and I'm going to test your gag reflex. Perfect. Move on to the neck. I'm going to inspect your skin. Okay, your skin is pink, normal for ethnicity, warm, dry, smooth, and intact without bumps, blemishes, lesions, bruising, or nubby. And your skin turn is less than 3 seconds. And I'm going to assess your trachea, and that is midline. And I will palpate your thyroid gland. Okay, and swallow for me. Perfect. I did not feel your lobes, and your thyroid was hardly palpable. I am going to palpate your carotid arteries for a minute, not on both sides at the same time. And those are brisk. And now I will auscultate them. No bruise can be heard. I am going to test your range of motion. Will you look up, down, left, right? Now tilt your head to the right and the left. Perfect. And now I'm going to do cranial nerve 11 with you shrugging your shoulders. I'm going to push down on them. Okay. Any pain or tenderness with the range of motion or the shrugging your shoulders? Assessing your anterior chest. If you are a patient in real life, I'd have you take off your shirt so I can assess your skin for the color, temperature, moisture, turgor, texture, edema, bruising, scarring, nubby, and lesions. I am not seeing any signs of respiratory distress, no use of accessory muscles, tripoding, nasal flaring, retractions, tachypnea, or cyanosis present, and no obvious deformities and he's symmetrical. I will palpate your chest. Take a deep breath in and out for me. Okay, equal rise and fall with no asymmetry. Okay, say 99 for me.
99.
Okay, vibrations are equal on both sides. And now I will take a listen to your legs. Okay, a deep breath in and out. Good. And again. Good. Again. You breathe in for me. And one more time. Good. Okay. Lungs are clear to auscultation. I'm gonna step behind you, okay? Okay. So, like I said with the anterior, I would have you take off your shirt and inspect your skin for color, moisture, turgor, temperature, lesions, nubby, and bruising and scars. So now I will have you take a big deep breath in and out for me. Okay, you have equal chest rise and fall. Now say 99 for me, please.
99.
Okay, vibrations are equal on both sides. And now I'm going to percuss an all lobe. Okay, that is also good. Oh, shoot. Now, I don't know any obvious deformities either. I'm going to take a listen to you. Okay. Okay, take a deep breath in and out. And again. And again. And again. And again. 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 One last time. Okay, perfect. I'm going to auscultate. Okay. This is the aortic, pulmonic, Erb's point, tricuspid, and the mitral. And I will also auscultate the apical pulse here for a full minute. Okay. Your rate was 64, and it was regular. And I will also palpate the PMI in the left midclavicular fifth intercostal space. It's right here. Okay. I'm going to have you lie down. I'm inspecting for any heaves or lifts, and those are not present. Now I am palpating over the auscultation point for thrills. No thrills noted. Now I'm going to listen. Aortic, pulmonic, Erb's point, tricuspid, and the mitral. Okay. And now I am assessing for JVD. And JVD is not present. If we were in real life, I'd have you raise up your shirt so I can assess your skin for its color, moisture, temperature, turgor, bruising, lesions, rashes, and blemishes. And now I am going to, your abdomen is flat and symmetric, and now I'll auscultate to listen for bruise. Your aorta, right renal artery, left renal artery, right iliac artery, left iliac artery, and your femoral arteries. No bruise noted. Now I will auscultate your vowel sounds, starting in the right lower quadrant. Okay, vowel sounds are present in normoactive in all four quadrants. And now I will percuss in all four quadrants. Nothing abnormal noted there. And I will palpate. Light palpation first. Any pain?
No.
No? Okay. Now deep palpation.
Okay.
Okay. Those are soft and non-tender. And now I will palpate the liver. Any pain?
No.
Okay. And the spleen. Any pain?
No.
Or tenderness? Okay. And now I'll have you sit up. And I'll assess your CVA. Okay. All right. Now to the upper extremities. I'm going to assess your upper extremities for warmth, color, skin integrity, and edema. Okay. Okay. Skin is warm to touch, pink, free from edema, intact, and no skin or abnormalities. Now I will be inspecting and palpating your joints of your hands. Okay. And your wrists. Okay. Your elbows. Okay, turn over this way. And your shoulders. Any pain on palpation for that?
No.
For any of them? No? Okay. So there is no redness, swelling, deformities, tenderness, nodules, crepitus noted, and everything is symmetrical. Now I will palpate your capillary refill. Okay. Capillary refill is less than 2 seconds, and your radial pulses. Those are 2+. And will you move your fingers for a range of motion? Active range of motion in your fingers. Can you squeeze my fingers? Okay, grip strength is strong, 5 out of 5. Can you do your wrist like this for me for range of motion? Head back, up, down. Active range of motion in your wrist and your elbows. Can you, there you go, for range of motion. Okay, and I'm going to assess your strength of your biceps and your triceps. So I'm going to pull, you pull and I pull, okay, and push and push. Perfect. Strength is 5 out of 5 there, and I will do the same for shoulders. Range of motion there. Okay. Good. Okay. And now have to do this for me to assess strength. I'll push down and you pull up, and vice versa. Perfect. All right. Now I will assess light touch sensation to your extremities. Will you close your eyes for me and tell me what I'm touching with? If it's soft or hard?
Soft.
Okay.
Soft. Hard. Soft. Hard. Hard. Soft.
Okay. Now keep your eyes closed and put your hand, the palm of your hand up, and I'm going to put something in it and you tell me what it is.
Pen?
Yep. And keep your hand up, and I'm going to draw a letter on it and you tell me what I am drawing.
B.
Okay. And I do not have a tuning fork to assess vibratory sensation at the wrist. You can open your eyes for me. And now I will assess cerebellar coordination. So will you do this for me with your fingers? Okay. And flip your hands up, back and forth. Pronate and supinate them. Okay. And now do the finger to finger like this. Perfect. And now I will assess the deep tendon reflexes. We'll start with the brachioradialis. Okay. All right. And now the tricep, or I'm sorry, biceps. Just relax that for me. Perfect. And the tricep, just relax. Perfect. And now we will move down to the patellar. Okay. The Achilles. Good. And the Binsky. Okay. Now I will be assessing your lower extremities. I'm going to assess all of it for warmth, color, skin integrity, and edema. Your skin is warm to touch, pink, and intact without abnormalities and no edema present. And I'm going to look at your toes, palpate your toes and inspect those. Same for your ankles. Okay. And your knees. Okay. All right. Any tenderness in those areas I just touched?
No.
Okay. No tenderness. They're symmetrical, and there's no redness, swelling, deformities, nodules, or crepitus noted. Can you move your toes? Okay. Active range of motion in your toes. I'm going to assess capillary refill. Okay. Capillary refill is less than 2 seconds, and I will assess your dorsalis pedis and your posterior tibial pulses. Okay. They are 2+ bilaterally. And now move your ankles, just push them. Okay, now go up and down on them. Okay. Range of motion is active in your ankles, and I'm gonna have you push on my hands, pull up on them. Okay, strong 5 out of 5 for your strength, and going to do the same thing for your knees. Okay, I'm gonna push down and you pull up with your knees. Okay, and opposite. Perfect. Knees are strong 5 out of 5 as well, and for hip strength, I'm going to push in and you try to, resist them. Okay, good. Hip strength is 5 out of 5. And now we will do the soft touch. You close your eyes for me and tell me whenever I'm touching you soft with the soft tip.
Hard. Soft. 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 Hard. 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 Soft. Soft. Soft.
Perfect. Okay. And I do not have a tuning fork to assess the medial malleus that would assess for peripheral neuropathy. Now that I have you standing up, I am going to palpate your hips. Just stand right there for me. Any pain there?
No.
Okay. In a normal setting, I'd obviously be able to assess his skin for redness, swelling, deformities, nodules, crepitus, and he has no pain and they appear symmetric. And I'm going to have you do range of motions with your hips. So lift your hip up and back and go outward and inward. Perfect. And can we do the same on the other side? Up, back, outward, inward. Perfect. And you have active range of motion in your hips, and we will do range of motion in your knees. So just kick it out and back. Perfect. And out, back. Perfect. You have active range of motion in your knees. Can you please turn around so I can inspect your spine? And lean forward for me and just dangle your arms. Okay. Spine is symmetric. Any pain there?
No.
No? Okay. You're good to stand up. Expected curvature is present and spine is aligned. And he has active range of motion without scoliosis. Can you stand with your feet together and your eyes closed for me? Okay, Romberg is negative, and you can open your eyes. Okay, and will you walk about 5 steps this way and then turn around and walk backwards, or turn around and walk back? Okay, gait is normal there, and do heel to toe, the same distance, and go back. Gait is also normal for that. And can you hop in place with your right leg and with your left leg? Perfect. No difficulty with balance present.